If you or a loved one has had a wound that hasn't shown significant improvement in 6 weeks or more, this video could save a limb. And I'm not being dramatic, I'm being honest based on 30 years of wound care data. And I'm going to show you the 5 signs that means it's time to stop waiting and start getting advanced treatment. And sign number 4 is really one of the ones that most people miss, and it's often the most dangerous. So let's get into it. I'm TJ Fabus, and my team and of our PAs and NPs specialize in advanced wound care that comes directly to you. We've helped hundreds of patients in 24 of all 50 states heal or greatly improve chronic wounds, and that's using advanced wound care treatments. And most of our patients do have Medicare coverage. So by the end of this video, you're gonna know exactly when wounds have crossed the line from healing normally to needs intervention, and what questions to ask your current provider, and what advanced care actually looks like in 2025. Now, this is about 10 minutes of your time, but it could mean the difference between healing in weeks versus months or preventing a much more serious outcome. And so here's why this matters. The hidden cost of waiting. Now, before we dive into the 5 signs, I need you to understand that most people don't know that standard wound care, the basic dressings, the let's give it more time approach, works beautifully for acute wounds. But you get a cut, you keep it clean, it heals, that's normal. But chronic wounds are fundamentally different, right? They're stalled in their healing process. And here's what most people don't realize. Every week, you wait for a wound that's not healing, and it's a week that your body's actually working against you. You see that the inflammation continues, the infection risk increases, the wound bed deteriorates, circulation to the area may get worse, and your body is burning precious energy trying to heal something on its own that it actually can't. And here's the hard truth. About after 4 to 6 weeks, if a wound hasn't shown meaningful progress with standard care, continuing the same approach and just, giving it more time, it's probably not going to work. And that's not failure on your part, that's biology telling you it needs a different intervention. But here's the good news. When we catch it at an early stage and introduce advanced therapies, provide your wound with growth factors and healing signals it's missing, we can see significant wound improvement rates. So what matters is timing. The timing matters. So let's talk about the signals and the signs that tell you it's time to escalate care. Sign number 1, there's no improvement in 4 to 6 weeks. Your wound has shown no meaningful improvement in standard care. Now, what do I mean by no meaningful improvement? I mean that the wound is the same size as it was a month ago. It's not developing healthy granulation tissue, that pink healthy tissue, that healing tissue that you want to see. Now, you're not seeing the wound edges starting to close, or you'll see a little improvement 1 week, but then it slides back the next. And this is frustrating because you're doing everything right. You're keeping it clean, you're following your doctor's instructions, and you're being careful. And yet, nothing is changing. So here's what's likely happening. Your wound has entered what we call a chronic state. It's stuck. The normal healing cascade isn't progressing. Your body needs a biological jump start. So if you think of it like trying to start a car with a dead battery, you can turn the key over and over and over, but without a jump start, nothing actually happens. And that's what advanced biologics do. They jumpstart the healing process. So if you've had a wound for 6 weeks or more with minimal change, that is your signal to ask your provider about advanced wound care options. Don't wait another 6 weeks, hoping it'll suddenly start healing, because more time with the same approach rarely produces a different result. So let's move on to sign number 2. Right? Sign number 2 is the wound is actually getting larger, or you're noticing it's getting deeper. And maybe when this started, it was the size of a dime, maybe something like this size here, right? Or a quarter, or you could only see surface tissue before, and now you're seeing deeper layers, maybe even bone or tendon. Now this is a major red flag. This is your wound actively deteriorating, not healing, and it needs immediate escalation. So something is actively working against your healing. And it could be uncontrolled infection, poor circulation, that's not delivering oxygen and nutrients, pressure or trauma, maybe that's repeatedly damaging the underlying tissue, or metabolic issues like uncontrolled diabetes. Whatever the cause, basic wound care is not equipped to reverse this trajectory, and you need an intervention that can address infection at a deeper level, improve the wound bed and environment, provide cellular building blocks for new tissue growth. So if your wound is getting bigger or deeper despite treatment, you need to see a wound specialist within the week, not next month, this week. And I've seen patients wait months while a small wound became a limb-threatening wound. Please don't let that be your story. Let's move on to sign number 3, right? Increasing pain, odor, or drainage. Now, maybe you're noticing these things, particularly like heavy drainage, foul odor coming from the wound. Now, I know this isn't comfortable to discuss. Now, patients often tell me, and our providers, that they're embarrassed, right, about the odor or the drainage, but these are critical medical signs, and we need to talk about them openly. So let's start with some of the pain. Some discomfort with a healing wound is normal, especially after dressing changes, but if the pain is increasing, it's keeping you up at night or it's getting worse instead of better. If pain medication isn't touching it, that often indicates maybe an infection or nerve involvement. Now, odor. A healthy healing wound should have minimal to no odor. So if you're noticing a foul smell, especially a sweet, sickly smell or strong odor, even after the wound is cleansed, that's often a sign of bacterial colonization or infection. Now, this doesn't mean you did something wrong. It means bacteria are present and need to be addressed with more than basic wound care. And finally, drainage. Some drainage is normal, but heavy drainage that's soaking through your dressings quickly, that requires multiple dressing changes per day, or that's thick, cloudy, colored like green, yellow, brown, these are signs your wound is not healing healthy, or it's not in a healthy state. So any of these 3 symptoms, that escalating pain, the odor, significant drainage, warrant a call to a wound specialist. Now, these often indicate that standard care isn't adequately managing what's happening inside the wound. But here's the good news. Advanced biologics don't just cover the wound. They actively fight infection when you provide advanced care. And they can reduce inflammation, they can create a healing environment, and even reduce some of that odor and pain in sometimes days or weeks, once we introduce the right treatment. So that's sign number 3. Let's move on to sign number 4. I mentioned this one earlier, and most people do not recognize this one or overlook this often. So sign number 4, red streaks, warmth, or systemic symptoms, right? And again, often missed the most amount of times. Now, the red streaks extending from the wound and that unusual warmth around the area, fever, generally feeling unwell, if you're experiencing that, I'll be very clear, especially if you see red streaks extending up from your wound, from your leg, your arm, this is actually a medical emergency. That could potentially be cellulitis or something worse, or infection spreading throughout your tissue. So do not wait for a regular appointment. Do not see how it goes. Over the weekend, you need to be seen immediately. Go to the emergency room if necessary. And why am I being so serious about this? Because when infection spreads systemically, it can become sepsis, which is life-threatening. And I'm not trying to use this as like a scare tactic. I'm trying to make sure you recognize a true emergency when you see one. And similarly, if the area around your wound is hot to the touch compared to the skin surrounding it, increasing red and swollen beyond the wound edges, or tender without even direct pressure, again, signs of infection. So again, pay attention to how you feel overall. If you have a chronic wound and you suddenly develop fever, chills, increased fatigue, weakness, confusion, rapid heartbeat, or just a general sense that something is wrong, these are systemic signs that infection may be in your bloodstream, requires immediate medical attention. Now, here's why I include this, because most people with chronic wounds will never experience this level of complication if they get appropriate care early. So signs 1 through 3 are your early warning system. Sign 4 is what we're trying to prevent by catching things sooner. So that's number 4. So let's move on to sign number 5. This is maybe you have underlying health conditions that affect healing, so particularly diabetes or circulation issues. And this applies to a lot of the people that are watching this video. So if you have diabetes, peripheral artery disease, venous insufficiency, poor circulation for any reason, your chronic wound automatically falls into the needs advanced care category. Because here's the reality. These conditions fundamentally change how wounds heal. Right? Diabetes affects healing in multiple ways. High blood sugar impairs immune function, damages blood vessels, and reduces sensation, so you might not even feel the wound worsening. And poor circulation means, well, your wound isn't getting adequate oxygen or nutrients. And it's like trying to build a house that the supply trucks can't reach the construction site. Your body wants to heal, but it doesn't have the resources to do it. And if you have these conditions that you've developed a wound, even a small one, I want you to be proactive, not reactive, because standard wound care might not be sufficient from the start. You may need advanced therapies right away to overcome these healing barriers. And this is actually where mobile advanced wound care makes such a difference, as we come to you with hospital-grade advanced treatments, treatments that address the cellular and growth factor deficiencies that some of these conditions create, and you don't need to be ambulatory to access the best care. And before you worry about the cost, Medicare Part B covers advanced wound care, including advanced biologics when medically necessary. So if you have diabetes or circulation issues with a chronic wound, that typically qualifies. So why don't we talk about what advanced care actually means? Right, because I've given you the 5 signs, but now it's worth our time to define what does advanced care actually mean. A lot of people hear advanced wound care and think it's complicated, expensive, requires hospitalization. Let me clarify what this looks like in practice. Advanced wound care means specialized assessment, first and foremost, where we're looking at the wound bed, the edges, the tissue, the type, circulation, the infection markers, everything that affects healing, right? And addressing any of the underlying barriers. We don't just dress the wound, we identify and address what's preventing healing, and our PAs and NPs are doing this. Number 2, biological interventions. This is where advanced biologics come in. So let me explain. Amniotic tissue grafts, because this is one of our specialties and modalities that we use, and it's incredibly effective. Now, amniotic tissue comes from, you're right, donated placental tissue after healthy live C-section births. It's processed and used in advanced wound care because it contains growth factors that signal your body to heal. Now, I'll be clear, this is not stem cells. This is very different, right? This is a signal to your body to create its own healing cells, right? And what that does is it helps to create proteins that reduce inflammation and then build a biological scaffold that new tissue can grow on. So if you think of it like this, right, we've been using the construction metaphor throughout the entire video, right? So your wound is like a construction site where work has stalled. And the amniotic graft brings in the foreman, the blueprint, and the building materials all at once, right? It gives your body the signals and resources it needs to finish the job. And I'm sure you're wondering, right? This is FDA regulated, well-researched treatment. It's been used successfully for decades, and the results have been really positive. So here's what actually makes our approach different. See, we're able to bring this advanced treatment to you, right? You don't need to travel to a wound center. You don't need to navigate a hospital system. We come to you with everything needed. So the sterile supplies, the advanced biologics, the specialized assessment tools. We evaluate the wound. Our clinicians are doing that, apply the graft if appropriate, and create a comprehensive plan of care. And typically these appointments might last anywhere from 30, 45 minutes, sometimes an hour. And the application itself is painless. Most patients tell us they feel relief within a few days because that inflammation is actually reducing and healthy tissue is starting to form. Now, I'm not going to tell you every wound heals in one treatment. That would be crazy. Most people need multiple applications, 5, 6, 7, 8, 10, right? Some need additional interventions like debridement or addressing the circulation. But what I can tell you is that when we do these advanced treatments, pair them with biologics at the right time, we're working with your body's healing capacity, not against it. So let's talk about what you should actually do with all this information now, right? If you recognize any of the 5 signs in yourself or a loved one, step 1, first, don't panic, but don't wait either. All right, so for all these signs, you need to escalate your care within days, or not months. Start talking to your current healthcare provider. Tell them specifically what is going on. My wound hasn't improved in X amount of weeks. I'm noticing X, Y, and Z. I want to discuss advanced wound care options. And now I'll be honest with you, because not every primary care provider specializes in wounds. They might know a lot or might not know a lot about the latest in biologics, and that's okay. That might not be their area of expertise. But that's where specialists, like companies like ours, come in and focus. And again, we focus exclusively on those chronic complex wounds. We know the latest treatment protocols, we have access to the advanced biologics, and our clinicians are all exceptional in providing the actual treatment. So we come to you. So here's what I want you to do next, right? We've put together this opportunity for a complimentary consultation, right? It's a genuine assessment where we'll review your current history, current treatments, answer questions about advanced options, and tell you honestly if this might be appropriate for your situation. And then we can even discuss Medicare coverage and next steps. And again, there's no obligation, there's no pressure, just information and guidance from someone who does this every day, one of our clinicians on our team. And all you need to do is click the link somewhere down in the description there. It'll take you to a simple form. You fill in your information and we'll reach out to you within 24 hours to have that discussion. So look, if you or your loved one has ever been dealing with a wound like this for weeks or months, you've been patient, you've followed the instructions, you've hoped it would just heal, it's okay to say, I need some more help. It's okay to advocate for yourself or for your parent or for a loved one. It's okay to ask for advanced treatment because you deserve to heal. And we may have some of the tools to help you get there. So again, the link is in the description, and I hope we're able to help you get this wound improved.